Hello and welcome to Sex Health with Dr. Gousse. It's the show where we discuss issues related to reproductive, sexual health, and talk about the newest treatments that are available today. I'm your host, Susanna Sampeur. For today's topic, it's hormonal imbalance, and we know it affects many in our community for both men and women. Can you tell us what is hormonal imbalance and why is it important for women and men in our community?
It is a very important topic because both men and women, all human beings, are truly affected by hormones. In fact, not only men and women, animals have hormones also.
Wow.
So it's a very, very important part of life. A hormone, in essence, is a biochemical structure that your body produces, usually in very, very, very small quantity. But it gets released directly into your bloodstream.
Okay.
And although it is produced at very small quantity, it has huge effect on your body and the physiology of the body, the way your body functions. But what's very important that these hormones, they are in many parts of the body, both in men and women. And there are many types of hormones.
So tell us, what is exactly hormonal imbalance and how can that affect our lives?
Yeah, normally in normal physiologic state, that means when everything is working fine, the hormones are at the perfect level. Okay? But what happens is often, as we get older, the hormones start to change in terms of the quantity. Because you see, the organs which produce the hormones, the factories which produce hormones, the organs start producing less, and therefore now you're starting having lower level, and some hormones may go up, many of them go down. So then you have an imbalance of what normal hormone levels usually are supposed to be. The male reproductive organ that is of great importance are the testicles. And the testicles, not only they produce the sperm, the semen that allows a man to reproduce, but also the testicles produce a very important hormone called testosterone. And the testosterone itself plays multiple, I could almost say thousands of functions in the men. But the females have a different organ that plays a very important role in reproduction, and these are the ovaries. And they are the main producers of a hormone called estrogen. So in the man, estrogen starts decreasing as they get older, and same thing, they call it andropause in the man, and the female, estrogen starts decreasing as a woman gets older, and they call it menopause. So these hormones, particularly the estrogen, and also a hormone called progesterone in the women, they are the one that regulates your menstrual cycle. So one of the signs a woman will see when the hormones are starting to get imbalanced is that they're not having their regular period. And the man is starting to have symptoms as well. So reproduction is associated with these hormones. Now, one very important point, if I may add, is that men, their dominant hormone is testosterone, but men also have estrogen in their body. In women, the dominant hormone is estrogen, but they also have testosterone in their body. And all these hormones together are important. So there's a misconception that women don't have testosterone and they don't need testosterone, but it is completely false.
But I would like to be more clear about what many roles that it plays.
With the female, the hormone estrogen plays a very important role in able to reproduce. It plays an important role in feeling good about yourself. It plays an important role in sleep. It plays an important role in protecting you from breast cancer. It plays an important role in weight control. plays an important role in appetite. It plays an important role in controlling your body temperature. That's why when you're missing
your life in general.
Yeah, there are estrogen receptors all over the body. Okay. But all these hormones, I forgot to say, are controlled by the brain, by the way.
Wow.
Because the brain sends signals to these organs, to a tiny gland that is inside of deep in the brain called the pituitary gland. And that gland is like the chief of the orchestra that tells all the other hormones, all the other organs how to actually behave. So when a woman is missing these type of hormones, it affects their sexuality because their vagina becomes very dry and sexual intercourse becomes painful. They lose their libido, so they no longer have the same sexual drive they had. Mm-hmm. They are very cranky. They are very anxious.
Moody.
So they're very moody, thank you. So a lot of the changes, and obviously they have hot flashes also when you have menopause or perimenopause. So these are all a lot of these, characteristics. Mm-hmm. It affects other parts of your body, including your bones, for instance. Nice. Your bones start getting weaker when you don't have estrogen. You start getting more urinary tract infections, more bladder control issues. I mean, it goes on and on. I mean, we could spend an entire half a day talking really about how many type of symptoms you could have from hormone imbalance and deficiencies. Okay. What happens to men, if they lose testosterone, they started having low libido. They're no longer interested in sex. Their sex drive goes way down. Their erection goes way down. Okay. They have sleep problems. They also are very cranky. They have low motivation, and they have what is called brain fog. Sometimes they're thinking about something, like, what I was thinking about, they forgot, and they don't have the mental acuity. They can't focus. They can't get the job done. Physically, they're weaker. They tend to go less to the gym. They're not motivated to go and lift weights or exercise, ride their bike. They become like couch potatoes, many of them. And the couch potatoes often, what happens is because they don't exercise, they don't do anything, they're gaining weight. And many men who are overweight will have low testosterone. Now, low testosterone is very dangerous because it increases your cardiovascular risk for heart attacks and other diseases. And it predisposes you to diabetes, for instance, and other serious health conditions.
What are the options in hormone treatments?
It's called hormonal optimization. Okay. So you bring the hormone levels to optimal. One of the first things you do, you have to measure the hormone levels when the patient has symptoms. So once you know how deficient they are, you know what quantity and how to replace the hormone until you get it to what we call normal hormone levels. Okay. So in a woman sometime, we can find out that they're missing both estrogen and they're not optimizing testosterone. Okay. So we will give the woman some testosterone, and a lot of people don't know that. They do not know that it's possible, and it's very useful sometimes to replace a woman's testosterone. And that can make drastic changes in so many aspects of their body. And some investigators believe it's even more important to replace testosterone in a woman than estrogen itself, which is known as the female hormone. So you have to sometimes replace both, and also sometimes, particularly if the woman has their uterus in place, you have to also replace the progesterone level. Because if a woman has their uterus in place, it's not safe to only replace estrogen. You got to also replace progesterone. And it's an entire art.
If someone is watching this show right now, but she has some information or some symptoms, what would you tell that person to go see an urologist just like you?
Yeah, I think it's a good idea for this person to see a clinician. Doesn't necessarily have to be a urologist. It has to be a clinician who has intimate knowledge, expert knowledge in hormone and hormone replacement therapy.
But how would she know that she needs, she has hormone problems?
By listening to the show, because you have given them clue in terms of we've talked about various symptoms.
Okay.
Unfortunately, there's something in medicine that I must share with you. Only 7% of clinicians are well trained to understand and manage hormonal imbalances. So there are many clinicians who are practicing who do not have sufficient knowledge and sufficient skills to actually manage hormonal imbalances. So if someone is listening, they must do a little bit of homework and kind of make sure if they're going to seek hormone optimization, that they see a clinician who has expert knowledge or significant knowledge who can treat it. Because some clinicians, because they're not trained and they don't have the knowledge, when the patients present with the symptoms, they don't know what to tell them, they don't know what to do, and they don't manage them. Unfortunately, it's very important to say something on this show today. Something bad happened in medicine. Okay? Initially around, let's say 2002, there was an article that came out saying it's dangerous to give women estrogen.
Why?
So, because they thought it was associated with breast cancer. It caused breast cancer.
Okay.
But about, let's say 15, 16 years later, what they discovered, the study was faulted. Now, we know as clinicians, particularly those of us who specialize in hormonal therapy, that is absolutely not only safe to replace estrogen in most women, in addition, it is protective. It brings benefit with respect to certain cancer, including breast cancer. You could actually diminish in some patients the incidence of breast cancer with estrogen replacement therapy.
But what's the youngest case have you seen for like people with hormonal imbalance?
As young as in the 20s in some men, but these are rare. Often they are metabolic things, congenital. You know, they are like sometimes, for instance, the pituitary gland, for instance. Let me give you an example.
Even mean?
It's a gland that is deep in the brain.
Okay.
And it malfunctions and it produces a hormone, a little tumor that produces a hormone called prolactin. Okay? And that hormone, what it does, it decreases the level of testosterone.
Okay.
So you'll have a 25-year-old man who has a testosterone that's way bottom. And if you're not knowledgeable in hormones, you would know to check the prolactin. Once you check the prolactin, for instance, you'll see it's sky high, then you get a brain CAT scan, then you'll find the pituitary tumor, you resect it, you treat it, and then they're back. The incidence of erectile dysfunction starts in your 40s, late 30s, but mostly in the 40s. 40 is pretty much almost the magic age when men start having decline in sexual performance.
Okay. So if a man is in like 20s, 30s or not being able to function, that's something. So don't go try to buy energized drinks and do all of the stuff that I know you guys are doing out there. Just go see a doctor. That's what you're saying?
Absolutely. I think that sexual dysfunction, both in men and women, is very, very closely associated with medical disorders. 9 out of 10, there is a biological, there's a medical reason for having sexual dysfunction.
From what you're saying, I feel like if you have these conditions, you're not being okay mentally. How do you think this can improve our mental health?
Let's call it behavioral changes, which occur in men and women, are related to hormonal imbalances. So you could see the personality of your husband, for instance, or of your wife has changed drastically. And you wonder what happened. And when you want to go deep into it, what you will find is, it's because of the hormone imbalances, the hormonal changes. And we know that for a fact, because once you replace the hormone, they regain back their personality. Some of my patients tell me that they become a completely different person. They became young again.
Wow.
Is the common theme. Doctor, this treatment caused me to become young again. They're happier with life. They want to do things when you were in your teens and your 20s.
And I had the great pleasure of speaking with one of Dr. Gousse's patients, Jay Ramos, 65 years old man, someone whose life changed with the treatment that Dr. Gousse provided. Let's take a look. Hi Che, thank you for joining us today and for decided to open up about your story. I know there are a lot of people at home who may not even know what is hormone treatment. I would like to know, why did you decide to tell your story?
Well, there's a lot of reasons why. It's multiple reasons, but mostly because of my health. I was out of shape, I was tired, I was working hard under extreme stress, and I needed a way to get my life back, to get back in life, to get back in shape. So I heard about hormone therapy and I decided to try it. And so I did, I started. And little by little, between Dr. Gousse and my primary physician, they were very interested in my blood work. They got all my meds, finally got my meds straight. And my body just started reacting, and I just started losing weight. I've lost close to 100 pounds.
Wow,
without
impressive.
any dieting, anything whatsoever. I drink wine every night for dinner, no big deal, everything's cool. But it's mostly because my body is balanced and my hormones are balanced. But most of all, my wife can tell me when I'm fading. When it's time for me to be taking the shot, it's because it's obvious. I start to fade. It's the bounce of my step. It's everything, my daily routine.
Wow, that's impressive. But I want to know, did you have any symptoms?
I was constantly tired, constantly not sleeping well. It just was a horrible process towards death, really.
Wow.
Slow death.
Prior to that, you had no idea what was hormone?
No, I had no idea. I mean, I had friends that were going to the gym and illegally pumping up, but I didn't want all that big giant mass and everything. I just wanted to just be normal and look good. So my doctor, my primary physician, referred me to Dr. Gousse. I had no idea what I was walking into. And here we are years later, and it's been a great relationship, and we talk about everything, and he's been my savior.
Great. But what treatment did you end up getting?
Well, part of it is the hormone therapy, which gives me the energy to get up and go to work. I'm in a very stressful business, and we put in 17 hours a day. When I tell you that we're dealing with presidents of banks, and they're not real nice people, and it's very stressful, it's true. So the testosterone really helps me, have that edge and be able to compete in the business that I'm in. And it's very, without it, I would fall apart.
Okay, because I don't know whatsoever what is hormone therapy. Can you kind of explain it a little bit from your point of view?
When you're a young lady.
Okay.
Look at your youth, look at your beauty.
Definitely. Forever.
I was young and beautiful at one time in my life as well. And so what happens is when you reach a certain age, those rejuvenating factors in your life start just falling away. Mm-hmm. And with this hormone therapy, we're able to bring it back. Now my body's responding. I'm a 20-year-old again. I mean, and in every single sense of the word, I'm a 20-year-old. Even, and I hate to say this out loud, but even sexually.
Okay.
I'm sorry, but it's.
I mean, you gotta please your wife.
Hey, but listen, that's important because it's a symbiotic thing, and a lot of men are very selfish there, and we have a routine that we work on, and we take care of each other very well.
How has your life changed since getting the treatment?
Well, first of all, I was 100 pounds overweight.
Wow.
Not performing well in the bedroom. I hate to say that in front of a young lady such as yourself.
No problem.
Okay, and many things, but it's not only just in the bedroom, but it's also in business. I was tired, couldn't get out of bed, depressed. My wife would have to come in, give me espressos, shake me up, get me going. It was tough, it was terrible. I was in horrible shape, I was on my way to dying. The therapy completely changed my life, completely balanced my body. My body started losing weight, getting into shape. It just fell off of me because you need to have hormones as you get older. Yeah, as you get older, your body stops producing those hormones, and you need to replace those hormones so that you can continue to grow and be youthful.
I feel like this treatment is kind of make you feel younger, would I say?
Of course, I'm 20 years old again. It's without a doubt, people need this, and it's gonna put the bounce back in your life. The difference is when I was 17, 18, 19, I was dumb. Now I'm a very intelligent man, but now I have the same vigor of my 17-year-old self with the experience on how to treat a woman and how to be kind and give her, and to be a real gentleman and a real man with my lady.
But for the men that are watching, men like you that are watching at home, what would you tell them?
Well, first of all, the testosterone therapy is going to obviously step up your bedroom life. You're obviously going to perform better. You're obviously going to lose weight. You're going to look better. You're going to feel young, and you're going to be a lot more active. The only thing I can suggest to them, while all these benefits, health benefits are happening, pay attention to your wife. Be more careful, be more loving, be more careful to make those bedroom experiences not just about sex, but about love and just taking care of her and making sure that her needs are being met. You know, your needs are going to be met. You have to make sure her needs are met and make sure that she gets there every time.
Wow, that's a great story. But tell me, did you expect Jay's life would change so much better after the treatment?
In reality, yes.
Okay.
And the reason is many of my patients tell the exact same story.
Okay.
So I've kind of gotten used to hearing this exact story because it's very predictable. It is a scientific basis for recovery of the entire human being, sexual function, and quality of life. So it's a recovery.
Yeah.
And part of that recovery is hormone
Imbalance.
manipulation to restore imbalance. Now, obviously, not every patient has such a drastic improvement, but I would say the majority of them do.
Well, before we wrap for today, I want to introduce a new segment, one you might find especially helpful. We want to help put you in the right direction when it comes to your sexual and reproductive health. That's why we'll be asking Dr. Gousse your questions in what we're calling the Doctor is In. This one is from a viewer in North Miami. She says, Dr. Gousse, I am 54 years old and I've noticed that it's been painful to have sexual intercourse with my husband. How could you help with that?
Well, this is very common, and we hear this type of story because the average age of menopause is 51. So therefore, 54-year-old women is likely to be either perimenopausal, but most likely menopausal already, meaning they haven't had their period for more than 12 months. Okay? So typically they would have very low levels of estrogen because the ovaries won't be producing the estrogen, and no progesterone. So the lack of estrogen itself causes vaginal dryness. So the vaginal canal becomes very dry. And when the vaginal canal becomes very dry, the friction during sexual activity causes a lot of pain. So then that becomes a disincentive for the patients because they're going to have so much pain during sexual activity, they don't enjoy sex as much. Therefore, they're less likely to have an orgasm, and therefore they have less an incentive to have sex. And as if that is not bad alone, the estrogen itself causes decreased sexual desire. So they have decreased sexual desire, they have pain during sexual intercourse, so it really starts to ruin their sexual life, and they notice it. And the good thing is it's all reversible when you optimize the hormonal level in these women.
So what she needs to do is to consult you.
Consult any clinician who's very knowledgeable in estrogen and hormonal replacement therapy. It's important to consult a clinician who's very well trained because there are potential side effects if you do not use the right rules and guidelines when you are treating with hormone. It's extremely safe, but in the right hands, and clinicians who know how to optimize hormones.
Nice. Thank you so much, Doctor, for this great episode.
You're welcome.
And remember, all of our episodes can be found online at islandtv.tv. We'll see you very soon and wish you the best of health. Bye.